Making remarkable steps in development, several wards still lag behind in service delivery, hence posing a challenge to the aim to better lives in the said areas. Health being one of the major contributors to a growing economy, Ichuni ward in Kisii County still struggles to meet the need because of poor state of health facilities in the ward. The ward has 3 health centers, but Ekerubo Health Center is the main as it lies in the center of the ward. Our visit to the facility to ascertain the level of health services in the center revealed shocking details, as the hospital lacks a proper maternity wing despite an existing one stalling and completed for the last 15 years now. According to the residents, the project was initiated by the then area MP Hezron Manduku with an aim of easing the burden of delivery to expectant mothers in the ward. For over 15 years, the project has remained stalled in the area, forcing residents to seek medical assistance in the nearby areas which lies miles away.
The major challenge we are facing here is the maternity wing, because in the entire ward we don't have such a wing.
According to them, the project was proposed to house a complete maternity wing, a mother and child wing, a fully equipped theater room for surgery in complicated areas.
Something must be done. This facility, let it be improved, let it be empowered, so that now we can have a maternal wing. Our mothers face a challenge when it comes to delivery. We don't have such an essential service in our entire ward.
As comparing to the catchment, the way I've gone through, this facility needs a level for facility. I was asking myself a question: what if you get an emergency? A mother who needs to deliver and need a cesarean section.
The residents now attribute lack of the essential service in the hospital to lack of goodwill by the past regimes of leaders and inadequate funding by local government and donors, because the facility lies in a swampy area, hence its name Ekerubo, for flat land.
Ekerubo, from our forefathers and the studies that we do learn, Ekerubo is a swampy place. Swampy. In other words, it's full of water. So our forefathers, or we grew up knowing that Ekerubo came from that that situation. That is a swampy place.
From sources, the facility seems to have a lot of challenges, including lack of a proper waste disposal area, a fence around the facility, and flooding waters owing the nature of land in the area. With all facts put in consideration, it's evident that Ekerubo Health Center in Ichuni ward, serving up to 500 people in a week, plays a vital role in provision of health services in the ward, despite missing crucial amenities that should be provided in the facility.
For a patient to be treated well, he has to be examined. He or she has to be examined. But it is quite unfortunate that we don't have a lab here that is well equipped.
Yaba basoire batokonye enyegitari yekine egende kwanza chinyombe chitaraera chiere arafu maternity ebebuya abarwaire baito bonsi bali barwarete barwari gugaiga ase burwaire bonde bwensi.
Due to the lack of a proper maternity wing, now pregnant women who turn to the hospital for deliveries are forced to be turned away or referred to other health facilities that are far miles away. A clarion call therefore has been made by the residents to any well-wisher, including local and national governments, donors and non-governmental organizations, to step in and complete the much-needed maternity wing in the hospital.
Gitarisa kutoka ngebate maternity rengi ya setoranya ro bunyakita porwari obu aba abangina baito bari konyora banange egerento tinya kutwara abangina bago tosirera tuatigara abana batigara bari chintakana.
Through mobilization of funds, the residents are confident in the area MCA Honorable Wycliffe Siocha that the completion of the maternity wing will boost health facilities in the ward and cut costs of referral to other areas. Reporting for the Health State in Ichuni ward, Kisii County, my name is Wilson Omenge.